Dr. Baney. I'm sorry I'm not able to be there this week. My son is having surgery right now. So we're recording this video to make up for it. So basically what we're going to talk about today is drawing blood, phlebotomy. You guys are going to do this on a dummy arm, not on each other. In the past, you used to do it on each other. So the first thing whenever you're drawing blood is you want to assemble your equipment. What you guys are going to use are butterfly needles. So this is a butterfly needle, and this is the vacutainer. So the first thing you want to do whenever you're drawing blood is assemble your equipment. You don't want to walk in the room and be fumbling around with someone with a tourniquet on their arm. So when you open this up, you're going to see that there's a little plastic sleeve over it. You're going to remove that plastic sleeve and straighten it out. Right here, you want to make sure that this is connected well. Push it in, because otherwise what will happen is if this is loose, blood will flow out here and not into your test tube. So this is the vacutainer. It only goes on one way. It screws on. So you're going to screw it on and make sure that it's firmly connected. In this gray part is a needle, and that's what pokes your test tube. So make sure that you don't poke yourself accidentally with that. Then this is the end that you're going to be drawing with. This is called a butterfly needle, and you see these little grippers? That is what you're going to grip. Okay, so this is how we're going to go in. When you go to draw blood, you're going to go at a 15 to 30 degree angle depending on how deep the vein is. All right, so that's the first part. The next part is you want to put on your gloves before you do anything, because when we apply the tourniquet, it's kind of painful and the person does not want to sit there for a while with the tourniquet on their arm. So tourniquets and Band-Aids are the hardest part of drawing blood. So when you apply a tourniquet, you're going to pull it as tight as you can. You're going to make a cross at the skin like an X, and you're going to tuck one side. That's it. You want to do this so that way in case someone's having a lot of pain or freaking out, you can easily just pull it and the whole thing comes off. You don't want to put a knot in there. You don't want to tie a bow in there. It's just a quick tight X and tuck one side. Okay? The next thing you're going to do is palpate for the vein. And when you palpate for the vein, you're going to feel something that feels like a worm or like a piece of spaghetti, like al dente spaghetti. And of course she has like one tiny little baby vein right here. I don't know if you guys can see that. So it's not necessarily what you see, it's what you feel. So just because you might not see anything, but you palpate and feel this vein, like you can't really see that vein very well, but when I feel it, you can feel that it's kind of springing back at us. So next thing we want to do is we want to clean the area really well with rubbing alcohol. Okay, so now this is what you will be doing with your dummy arm. So when you grip the grippers, you're going to pull this straight off. Don't poke yourself with the needle. If you see there's a little bevel, and the bevel goes up to augment flow. Can you see that? Kind of, sort of? Mm-hmm. Okay. All right. So now the area that we've cleaned, we don't want to touch it again because that will contaminate it. What we're going to do is we're going to pin down that vein. So we're going to feel above where the vein is to kind of hold it down. Then you're going to go in quick, but not deep. Again, about a 15 degree angle because this is superficial. So we're going to go right in, and you see this flash. That's how we know we're in her vein. See how we see this blood? Okay, so now we're going to apply our test tube. And again, there's a needle in there that's going to pierce it. This feels by a negative pressure. Okay, so when we change out the test tubes, we're going to fill it, and then we change it out, making sure that we don't disturb this. Now, the most important thing when we're done drawing blood is that we take the tourniquet off first. Then we apply pressure with gauze. Oh, shit. Can you hand me a cotton ball? Mm-hmm. With gauze, you do not want to use the alcohol swab because that will not allow it to clot. So you're going to apply pressure above, and you want to pull it out fast so that way they don't feel anything. I make sure that the tube is not completely filled. That way it doesn't drip blood out the end. You want to hold it for me? Normally I would do this, but I want to show you guys. Then the final thing you're going to do is when you slide up the yellow safety, you're going to hold the plastics tubing and slide the yellow safety up from the bottom until it clicks. Do not hold on to here or here, otherwise it will not go. So hold the plastic from the bottom and slide it up. That way it covers your needle, all right? Then the whole thing is going to go in the sharps container, which will be there somewhere for you guys. Okay, and then the second hardest part. So first hardest part is the tourniquet, the second one is the Band-Aid. So putting a Band-Aid on, you seem super easy. Not so much when you have gloves on, all right? So she's been holding this now for 10 to 30 seconds. You're gonna check and make sure that she's not bleeding anymore. And then we're gonna apply our Band-Aid. Some people apply a Band-Aid over the cotton ball. I don't do that because these cotton balls are so big that the Band-Aid's just gonna pop right off again, okay? So I hope that was a good teaching. If you guys have any questions, you can always email me or ask me, or if you want to come to another session later on. The very last session, there's only a few students on that one, so if you want to come to that very last week, I think it's the 1st of March. All right, have a great day.